Right. So Nalini and I work as consultants in health protection. Nalini works on the North London side, and I work on the South. And the aim of our coming to the webinar today was to talk about some winter preparedness, and especially in that sense with the winter vaccines. So next slide, please, Nalini. And if you can put it on that mode, if possible, thank you. So with the winter season already started or about to start in that context, it's important to have timely vaccines. And I will start with the COVID and influenza first, and my colleague Nalini will then pick up the RSV, which is a new vaccine. The reason for having timely winter vaccine is quite clear, is in order to reduce infection risk and the risk of severe disease and hospitalization. That's the aim. Eligibility for COVID and influenza is quite wide range, but primarily it includes individuals who are 65 years of age or over, or pregnant women, or anyone with an weakened immune system or long-term health conditions that can potentially put them at increased risk if they were to catch the COVID or influenza viruses. So the whole idea is to reduce that infection risk. And for flu vaccination in particular, the eligibility criteria also includes children of certain age. And there are some links in the chat further down which specify which groups of children are offered the vaccine and how. Uh, Now, this question comes up quite a lot, why these vaccines are given on a yearly basis. And the idea behind these is that the viruses are always mutating and changing. And the idea is that the vaccine which is produced for that particular year is matched with the most circulating virus in the community. So the vaccine is tailored to the specific virus circulating as much as possible. And because these viruses change, the vaccination from previous year technically fades off. So the whole idea of getting a top up or vaccine every year is important in that context. Now, with vaccination season is starting for children, for particular flu vaccination for eligible children, it started already in September. And for COVID and flu, it started in October. And the aim is to have it by the end of November or early December. We should have as much people eligible for either of these vaccines to have received those vaccines in order to protect them when we go into the full-blown winter weeks coming up. And the the way to get these vaccine, there's a wide range of opportunities available to get these vaccine. I always suggest colleagues or asking for this information is to, if anybody is in contact with whichever service they normally use, whether it's through their GP practices, they are in regular communication for their regular visits, or they are in communication with pharmacy for the regular prescription, repeat prescription, etc., or going online, calling 119, which is a telephone service, and as you know, is free of charge, and you can ask for the translator as well for the specific language. These are all those venues which can potentially be explored in order to find out more about the vaccine and to actually book it and get it as well. Some areas also have walk-in clinics for COVID vaccination sites. So these blue text in there have hyperlinks behind them. So if when you get the slides, you can click on them and they take you to certain web pages where you can get more information. So for the COVID and influenza vaccine, there is one dose of each of those vaccines that can be given at the same time. The COVID vaccine available in the UK on NHS does not contain any animal products, including eggs. For the flu vaccine, the nasal flu vaccine, there are two types. There's a nasal and an injectable one. The nasal is primarily used for children, and the nasal vaccine is the one that contains small amount of porcine gelatin. However, an injectable vaccine can be requested from the clinician in order to get the vaccine for children in particular in that context. So those important links are also available at the last slide, and you can get more information from it. So I'll pass it over to Nalini from this. Thank you.
Sorry, I'll carry on with the vaccination theme. As Wazi's described COVID and flu, you will have heard a lot about flu. Flu vaccines have been around for some time. COVID vaccines have been around for the last 3 or 4 years. Now I'm going to talk about a new program for a virus that's also been around for a long, long time, but it's only this year that we've introduced a vaccine to prevent very vulnerable people from getting very ill with it. So that's the RSV program. Hopefully a lot of you have heard about it. This is a program for the most vulnerable to RSV, and that's very young children, so babies under the age of 1, and the elderly, and that's 75 years or older. And this vaccination program, the aim is to reduce morbidity and mortality from the RSV virus. So the respiratory syncytial virus circulates in winter, just like flu. It occurs every year. It generally starts in October and it lasts for around 4 to 5 months, and it peaks in December. So again, very much like the flu and COVID. And for most people, as you would expect, it causes a mild respiratory illness and is a common cause of colds and flus. But there are some populations that I've already talked about that are at risk of severe respiratory disease. And that's what we're trying to prevent with this vaccine. So from September of this year, 2 groups of people have been eligible for the RSV vaccine, and they've been, so we started offering it to them. And these are pregnant women who are 28 weeks of gestation or later. And these are elderly people aged 75 to 79 or turning 75 years old on the 1st of September this year. So with the pregnant women, the idea is they get the vaccine later in their pregnancy, and that protects their baby from acquiring this virus, or even if they do acquire it, it doesn't cause severe disease. And then for the older age groups, the idea is that they get it once within the 75 to 79 years. We expect to offer some years of protection. So it is a one-off vaccine. We expect that we don't need to repeat it, although those are decisions that are constantly being reviewed. And it's expected to protect for a few years. So I would urge everybody to sort of spread information about this and to discuss it with those who are eligible for the vaccine. Like with other illnesses that circulate in the winter, it could be a mild illness, but it may not be for the very, very vulnerable. So it's important to think about that. For the older age groups, it's available at the GP. And for pregnant women, it's to be given during every pregnancy, and it's available in maternity settings. It's also available at the GP, but generally this care is given in the maternity setting. One thing to note is older people are already being offered flu and COVID vaccine at the same time, but the RSV vaccine is generally not given on the same day as flu and COVID. It's generally given at a separate appointment unless your clinician decides that it's okay to receive the vaccine at the same time. So so this year you can expect a couple of vaccine appointments. And then generally around winter, so obviously our focus is very much on vaccines because that's what UKHSA does a lot of. So just to remind you, the annual vaccination campaigns are flu and COVID. And Wazi's gone through the eligibility for those. And the routine vaccinations, these are not necessarily about winter, but generally about keeping well. So for the older age group, we've got pneumococcal, shingles, now RSV. So I just wanted to remind people that those are available as well for the older age groups. And in general, get advice if you feel unwell. If you're in one of those vulnerable groups, if you're looking after a child who's very young, under the age of 1, or you're yourself in an older age group, or you have disabilities, or you have comorbidities, then if you feel unwell, get advice from your pharmacy GP or 111. There's advice on keeping warm and getting help with heating, and I believe that's on the agenda. And also, we would urge you to check that you and your family are up to date with vaccines, because these things will circulate, that we can't prevent a lot of things from circulating. What we can do is stop you from either acquiring that virus or bacteria or getting very ill with it, and that's what the vaccines do. So I'd really urge people to check that not just you, but your family are up to date with all the vaccines that they're eligible for. These are free vaccines. They're generally available at in general practice. In fact, your GP will be calling you in to say, please come and get these. And they are very safe and effective, and they've gone through quite a lot of research. And even after they've been introduced, they go through a lot of reviews. And then just a final reminder, if you're looking to get away soon, lucky you, please check that you have all the travel advice that you and your family need. There are a lot of travel vaccines that are not routine. They are particular to wherever it is you're going to. So please consider getting back advice on things like that. So just to give you an example, in September and October, we at UKHSA see an uptick in things like hepatitis A or typhoid. There are vaccines available for that. They're not completely effective, but they are effective to the point that you won't get severely unwell and you won't get very severe consequences. So please do consider those before you travel. And then we've added a few resources that you can access for all the vaccines available. And I've also added something for norovirus, because along with respiratory viruses, another thing that spreads quite a lot in the winter are things like GI illness, diarrheal illness, and viral illness. And you might have heard about norovirus in the news, and there's some information here on how to protect yourself against the spread of norovirus. That's it from us.